Hello guys, and I'm back here on June 30th. This is the 20th day post-op after my bariatric surgery. I'm here to chronicle the story of my bariatric surgery for those who need it, for those who are thinking about it, and for those who have significant medical problems associated with morbid obesity that can be damaging to your health and which are making your quality of life worse. You know, I'm only 54, so I consider myself still pretty young. But I know people who are in their 30s and 40s who are morbidly obese and who are at risk of the same problems that I had: high blood pressure, diabetes, high cholesterol, sleep apnea, morbid obesity, and even pain on your body because of the excess weight. I used to be a lot thinner. I was never skinny. I was always, I used to work out a lot, so I was pretty hefty guy, but I was not obese because I used to work out a lot. I used to run a lot. But after I had an accident back in 2018, I stopped going to the gym and I gained about 100 pounds in a period of 6 months. And I started having complications with sleep apnea, with diabetes. Even though I have history of diabetes in my family, my mother is type 2, my father was type 1. And I know what an ugly beast diabetes is. I didn't want to end up like my father with amputated legs, in dialysis, or going blind. I didn't want to have the same problem. So I want to tell you that bariatric surgery for me was a positive thing. And I'm sure that other people can attest that they lost a lot of weight, which is right then and there a great thing, because nobody likes to be overweight. You know how it feels when you're overweight. You feel depressed, and that's without having other medical problems that can come along with being obese. So I'm trying to educate people and educate myself as well. With this bariatric surgery was a journey for me because I had to wait a long time due to COVID and the pandemic. My surgery was postponed 3 times, and I had to repeat blood labs. I had to repeat x-rays. Then they asked me to do lung CT scan because the apnea was affecting my lungs. So I had to repeat everything before I qualified for the surgery. So, but you know, I'm pretty grateful that I was able to have it because it really has made a big change in my life. The doctor told me, well, first of all, I had to have the bypass surgery because I already had a really bad reflux problem, which caused Barrett's esophagus. My esophagus was burned from all the acid from the stomach. And then I also had a hiatal hernia, which is caused by extreme pressure from your gut, and it pushes your stomach, parts of your stomach into your esophagus. That was repaired during my surgery, but for the type of problems that I have with reflux and hiatal hernia, I couldn't have the gastric sleeve, which is where they cut part of your stomach and they make it smaller. It remains in the shape of a banana, so they remove about 2/3 of your stomach. I didn't qualify for that because I have pretty bad reflux, so they had to do the bypass on me. And as I said previously in my video from yesterday, I had to have general anesthesia, which is pretty much, you know, you get an IV, they put monitors on you, and the anesthesiologist gives you a set of medications to relax, to prevent nausea, for pain, and then to go to sleep. For this type of surgery, they also have to relax your body because they're going to increase abdominal pressure. It's done laparoscopically, which means they have to make 5 holes in your body, and I'll show you here the 4 holes that I have, not 5, 4, and they go up here and almost kind of like a square. And they pretty much insert 4 cannulas. One of them is a camera, and the other ones are cutting devices, cauterizing devices. And with the camera, they're looking at what they're doing, and with the other devices, they're cutting and clipping, and with another device, they're cauterizing. But before that, they have to insufflate your abdomen. They have to fill it up with air so that they can visualize better, sorry. And that allows for better viewing of what they're doing. Also, they have to put a retractor on top of your liver. Now, I had issues because they were wondering if I have fatty liver. In my test results, it showed that I have fatty liver, but fortunately, when they went in there, they said that my liver was only mild fatty liver, and they ruled out that I had any type of cirrhosis, and my liver wasn't enlarged. So I didn't have hepatomegaly, which is an enlarged liver. I basically had a liver that was mildly fatty. So that wasn't gonna be a problem, because if the liver is too big, sometimes it makes the surgery more difficult, especially if they do the gastric bypass, because the liver is in the way. But so when they do the surgery, they also put a retractor on top of the liver, and that's the part that hurts the most. This is where I had all the pain when I came out of the operating room. But as I said in my previous video, I didn't have any pain after I left the hospital, and today I'm on day 20 and haven't had any pain. Now, the one thing that I want to say is that, you know, you have general anesthesia, they have you go to sleep, they do the procedure, then they close you up. I had my anesthesiologist was nice enough to do a tap block on me, which is a block that blocks the nerve endings around your abdomen so that you have less pain. So the top block is done right before the surgery, and they inject in this area to help you with pain relief. Nonetheless, I didn't have pain here thanks to the top block, but I have pain here because the top block doesn't reach up here, and that's where the liver retractor sits. So that was where most of my pain was. But nonetheless, when you have this surgery, they gotta give you narcotics, and narcotics tend to make you constipated. So, and sometimes they also tend to prevent you from going to pee. So, I wasn't able to have a bowel movement for 6 days. They also told me that that I would probably have a lot of diarrhea after this procedure, because when you eat, food immediately goes to your intestine and you're prone to go to the bathroom. I think that's a myth. It's not true. It's not true as far as I'm concerned, because it's been the opposite for me. I'm on day 20, and as far as I can tell, I've only gone to the bathroom 4 times, but it's been solid. It hasn't been diarrhea, and it's been plentiful, because you don't eat that much. My experience has been that it's been such that I've been drinking liquids, and you take 1 or 2 sips and you're okay. You take a 3rd sip and you start feeling kind of full. If you take a 4th sip, you start getting a pain right here between your chest. And then you take a 5th or 6th sip, immediately you vomit. So unfortunately, I vomited 5 times, but it's been induced because I forced myself to vomit, because the pressure pain feeling that you get right here is too much. And so what you need to teach yourself after the surgery is to drink slowly. It seems like 64 ounces of water, which is what they recommend, seems too much, because you have to drink all day long and you have to take little sips, because if you drink too much, even water, it makes you want to vomit. So So you have to teach yourself to digest, to eat slowly. Now I started with chicken and fish. I'm not supposed to have any vegetables. I'm not supposed to have any fruits. I'm not supposed to have any sodas. Stay away from carbonated drinks because they make you puke even more. So you want to prevent the vomiting. So now I have to, it's a new me. You become a new person because you have to teach yourself to eat slower, to masticate, to chew food slowly and take a long time. Because if you eat fast like I used to eat before, you're gonna vomit, and the body will let you know because first you'll have pain and then you'll vomit. So you want to take it slow. You are a new person. So far I've lost 40 pounds. I used to be 270. I'm at 230, and my goal is to be 160, even though they say that I'm gonna probably lose more than 160. So my goal after that is to consume a lot of protein and take vitamins. They recommend that you take vitamins for life after this procedure because you know, your digestive system is in a new different process. So high protein content is very important. And then drinking lots of fluids is very important. So thank you for watching. I appreciate your comments. If you guys have any, if you have any questions, please feel free to send your questions and I'd be more than glad to answer all your questions. As I said previously, and I don't know if you guys were able to see it, this is what they recommend right after surgery. Premier protein, either 30 or 40 grams of protein and 1 gram of sugar or less. And then they recommend also this yogurt, Oikos, which has 0 calories. So that's what's recommended for surgery. And then other things that I will talk about in other videos is the usefulness of honey, turmeric, apple cider vinegar, olive oil high in polyphenols. Green tea is very helpful. And then I'll explain to you about this concoction that I made, that I learned on YouTube, that you're supposed to rub on your abdomen to burn fat, to burn the fat that's like right under the skin. Because even though I don't have a lot of external fat, I used to have, I have a lot of visceral fat, which I'm in the process of losing, which is pretty important because that still also makes you big and swollen. So thank you for now, and I'll follow up with other videos. Thank you.